Understanding gestational sac size variations.
Hello and welcome to our discussion about gestational sac size at 5 weeks. Pregnancy can be an exciting but also nerve-wracking time with many variables to consider, and one of those is the size of the gestational sac. Today, we'll discuss what it might mean if your gestational sac is larger than average at 5 weeks.
What is a gestational sac?
The gestational sac is the first structure that can be seen on ultrasound in early pregnancy. It's essentially a fluid-filled structure that surrounds the embryo in the womb. Typically, the gestational sac can be seen via ultrasound around the 5th week of pregnancy.
What is considered a normal gestational sac size at 5 weeks?
The size of the gestational sac can vary. At 5 weeks, the mean sac diameter, MSD, is typically between 8 to 10 millimeters. This measurement is taken from the outer edge of the sac to the outer edge on the other side. This size usually correlates with the weeks of the pregnancy, but remember, every pregnancy can be different.
Is a larger than normal gestational sac at 5 weeks a cause for concern?
A larger than normal gestational sac at 5 weeks isn't automatically a cause for concern. There can be variations in the size of the gestational sac among healthy pregnancies. However, if the gestational sac is significantly larger, it could potentially be indicative of certain complications such as a molar pregnancy or a missed miscarriage. It's important to remember that this isn't a definitive diagnosis and further investigation would be needed.
What should you do if your gestational sac is larger than normal?
If your gestational sac measures larger than the typical range at 5 weeks, it's essential to consult with your healthcare provider. They can guide you through the next steps, which may include additional ultrasounds or other diagnostic tests. Don't panic. It's important to remember that ultrasound measurements can have a degree of error, and further evaluations will provide a clearer picture. In conclusion, a larger than normal gestational sac at 5 weeks isn't automatically a cause for concern, but it does warrant further investigation. Always consult with your healthcare provider to understand your individual situation better. We hope that this discussion has been helpful to you. Pregnancy can be a journey of many unknowns, but remember, you're never alone in this journey, and there's always help and guidance available.